Hey, welcome back to Not So Complicated, and this is episode 2, Cranial Nerve to Optic Nerve. We are studying neuroanatomy, starting from cranial nerves. We will talk about root origin, then course, then branches, then functions, then lesions, right? So let's begin without further delay. So the root or origin of optic nerve is that the optic nerve originates from retinal ganglion cells in the retina, the posterior layer of the eye, obviously, and these cells receive input from photoreceptors like rods and cones, right? And their axons form optic disc. So this is the root or origin of the optic nerve, and the course is that from the optic disc the optic nerve exits the eye posteriorly again, passing through the optic canal in the sphenoid bone, right? So, and after passing through the sphenoid bone, what actually happens is that it joins the contralateral optic nerve, right? So like if it is a right optic nerve, then the left optic nerve will be joined together at optic chiasm in the suprasellar region. You can see the optic chiasma here, right? And that is where they are combined. And then like post chiasm, that is after the chiasm formation, what actually happens is that it forms the optic tract projecting to three different regions in the brain. So anything you see, it needs to be interpreted by the brain, right? So the three regions that are here is one of them is lateral geniculate nucleus, LGN for vision, and superior colliculus for reflexes, and pretectal area for pupil response. So these are the three regions where the optic tract is inserted in the brain, right? So there are no branches of optic nerve because it is not a true peripheral nerve and it is intracranial in distribution. Obviously, this is a reference image for you. You can see it. And then the functions of optic nerve is spatial sensory, again obviously vision, light and color and visual fields. These all are the functions of optic nerve, and it supplies retina through ganglion cells. And the testing of optic nerve is done via different things. Like if it is the testing for visual acuity, we do Snellen chart and visual fields by confrontation method, and fundoscopy for optic disc health, right? So let's begin the lesions. The lesions, there are different causes for the lesions and the effects of those causes, right? So the causes can be optic neuritis, as in multiple sclerosis, ischemic optic neuropathy, glaucoma, pituitary tumors, which causes chiasm compression, right? And then trauma or increased ICP, that is intracranial pressure, that will lead to papilledema. You can see this papilledema in fundoscopy. And the the effects of optic nerve are that there are optic nerve lesion like monocular blindness, relative afferent pupillary defect, which is also called RAPD. This is very high yield for USMLE. You have to remember this, relative afferent pupillary defect. And chiasm lesion can happen, and that will lead to bitemporal hemianopia. Example, that is pituitary adenoma, that is compressing the chiasma, right? And then the optic tract lesion can happen, which will cause homonymous hemianopia. And then papilledema, that will lead to bilateral disc swelling from ICP, right? That is the reason for the development of papilledema. So these are the causes and effects. That is all about optic nerve. Subscribe for more clinical polls like this. Thank you for staying with me.